but is it the standard of care? I mean, we talk about this, like a lot of patients don't even know. You just could say, hey, you want fixed teeth? Okay, you're gonna ride a denture for 3 months and then come back and then we'll uncover and convert. So if you're starting off and you want just something safe and predictable, there's nothing wrong with delayed loading, or some of the alternative approaches like the fixed bridge on the selective teeth. Super cool way to kind of mix and match that. But just plan for plan B, because don't tell a patient they're getting fixed teeth, like for sure, and then not be able to deliver that. That'll be disappointing. So, know your patient, talk to them about plan A, plan B, plan C, and then consider alternatives. So let's walk through a quick immediate loading protocol. And this is immediate loading, but really what this is just a denture conversion, because this can be done in a delayed loading approach. So you can place your implants, bury them, let them sleep, come back in 3 months, and then do a pickup. But it's essentially, you've got your multi-unit abutments screwed down. You've got those cylinders that we talked about placed on the implants. They put some sort of plug material in there because they just didn't want to eject anything into those channels. So either plug it or just be careful. If you want to use a rubber dam to block out your surgical site, you can. And you can punch 4 holes to block it out. Sometimes you don't need this, but if you want to just be super, super conservative and safe, go for it. You've got 4 holes in your denture. You're going to slide it over the cylinders, and you're going to pick it up. Now, this is an acrylic denture, so they're using acrylic to pick it up. A lot of what we're doing now is resin-printed dentures, and so we're going to use resin to pick it up, because you're going to match materials. So I love just core buildup material because it's dual cure. So you can squirt it in, light cure it, and get it started, and then it's going to continue to cure over the next 5 minutes. And then you're going to take your denture off, and you're going to cut off all the palate, the flanges. You're going to round it. You might backfill a little bit, and essentially you're going to get this temporary. And this is, you're going to do this in an immediate load fashion or a delayed load fashion, because you want to give them some sort of temporary, even if you delayed load them. And let them test drive something. Let them, have some sort of fixed temporary in there, because that's going to really be what that trial run is. Something fixed before you go to the final. I highly suggest that. So same kind of thing. This is kind of in our world, some sort of pickup here. Cylinders are in. There's some sort of printed resin pickup. Now this was printed with no flange, no palate, so you don't have to cut that off. Just 6 big holes here where the cylinders are sticking through, and then there's core buildup material that's dual cure. You can see how chunky I made this, because you want it beefy, you want it strong. So
eyeballing the midline at that point, you're going to have some play with holes that big, right?
Correct.
And how are you getting your occlusion right there?
Correct. Yep.
You can't even check your occlusion if you have big cylinders sticking out of it, right?
Correct.
So how far do you know right there to push up on the tissue versus back off of it to get your vertical right there?
It's a great question. So, like I showed early on, the stackable pinned pickup, it eliminates all that, right? But very complicated to plan and execute that. In this world, I'm building in a little bit of slop and a little bit of play. Now, ideally, if you plan the case correctly, the cylinders don't need to be touched. So this is sticking down a little bit. This one's right at the occlusal plane. So one of the things I love to do is, if you can plan the depth of your implants, because you can digitally put in a cylinder in the case and then have your cylinder just end right at the occlusal plane. That's kind of a good reference point that you have enough reduction. If this cylinder is sticking way out past, that means you're tight on space. And you know what I mean? And so, they're not going to be able to bite down unless you take off that cylinder and grind it down, which is kind of a pain. Take it on and off, grind it down. It's metal, there's shrapnel, So
you can also freeze before pickup.
Absolutely.
That's another strategy where how tall it is in your plan.
Yep.
And before surgery, you can even print out a model surgery and pre-cut the cylinders. I don't know if
And then you just have to make
before.
sure you fill them with some sort of material, or just don't get your resin in the hole, obviously,
Yep.
right?
Yep.
If they're down up underneath.
Yep. Yeah.
So on a case like this, what do you just kind of know your plan was semi-accurate? You pick that up and then you just adjust all your occlusion in by grinding on it, right?
Yeah.
It's just a temporary anyway. For a
Just
couple
temporary
months,
anyway.
right?
Yep.
Okay.
Yep. Good point. So I mean, I've just found that there's enough slop in it just to be able to, like, if it's sliding over your cylinders, most of the time I haven't run in where there's like all this play, because I haven't made my holes that big. I think they look bigger because there's a lot of material excess, but the holes that I usually make are either 5 or 6 millimeters in diameter, and when you slide that on, there's enough play in your surgery that usually this thing is barely fitting on.
Yeah, it's touching somewhere. Right?
It's usually touching something. Usually you're having to ream something.
And are you just basically pushing that all the way down until it hits the tissue?
Yes. Yeah. I'm kind of just pushing it on until it hits the tissue, and then just trusting that everything is good. And so far it's worked pretty well. Because you could have the vertical component. There could be some play in it. And so ideally,
So if your guy's off somewhere, you just add a bunch of resin on the occlusal somewhere.
exactly. Yeah. Throw some resin over here, grind it down over there, get it close. And a lot of times even what we're doing now is we're picking this up, scanning it, and then having a second screwed in temporary being made. And we call this the first junk temporary, where you scan some sort of bite, whatever it is, and they go home with that, and then they come back and they're actually getting a second healing temporary that's like really accurate because it was digitally planned and it's screwed down straight on. So yeah, but for most of the time, that you just get them close, and especially if you did a delayed loading and their implants are integrated, you uncover, just get them close, and then get ready to start your final restoration because the implants are integrated. Like, you're waiting for maybe a little soft tissue healing, but you can kind of go, and get going on different things.